Question number 1. A client was infected with TB 10 years ago but never developed the disease. He is now being treated for cancer. The client begins to develop signs of TB. This is known as which of the following types of infection? Options: Option A, active infection, B, primary infection, C, superinfection, and D, tertiary infection. Okay, so here the correct answer is option A, active infection. Okay, so here for some people they carry dominant TB infections that may develop into active disease. Okay, so in addition to their primary sites of infection, that is containing TB bacilli, okay, that may remain active for years and then activate when the client, okay, that is resistance power is lowered, otherwise their immunity power is lowered, or the patient is treated with the cancer. Okay, so as a part of the treatment of the cancer, patient is undergoing chemotherapy or radiation therapy, so there the immunity power will be lowered and this inactivated TB bacillus became active when the person's immunity power is decreased. Okay, so will we see the other options, okay, such as the tertiary infection and superinfections. Okay, that is does not apply in this case. Okay, so here the correct answer is the active infection. Question number 2. A client asked to why an electronic health record system is being used. Which response by the nurse indicates an understanding of the rationale for an EHR system? Options: Option A, it includes organizational reports of unusual occurrence that are not part of the client record. This type of system consists of combined documentation and daily care plans. C, it improves interdisciplinary collaboration that improves efficiency in procedure. And D, this type of system tracks medication administration and usage over 24 hours. Okay, so here the correct answer is option C. It improves interdisciplinary collaboration that improves efficiency in procedure. Okay, so the EHR that has several benefits for use. Okay, that is including improving interdisciplinary collaboration and making procedures that are more accurate and efficient. Okay, so let me see the other options. Okay, the option A, an occurrence report is an organizational record of an unusual occurrence or accident that is not a part of the client's record. Okay, and the option B, the integrated plans of care, this is also called as IPOC, that is a combined charting about the client conditions in a care plan format. And let me see the option D. So the medication administration record, it is also called as MAR, that is used to document medications administered and their usages. Question number 3. A 20-year-old college student has been brought to the psychiatric hospital by his parents. His admitted diagnosis is borderline personality disorder. When talking with the parent, which information would the nurse expect to be included in the client's history? Select all that apply. Options: Option A, impulsiveness, B, liability of mood, C, ritualistic behavior, D, psychomotor retardation, and E, self-destructive behavior. So here the correct answer is option A, B, and E. Okay, so option A, impulsiveness. Okay, so impulsiveness means that is the behaving without realizing the risk that is involved in the behavior. Okay, so that is mainly present in the patient with BPD. Okay, so it is a pervasive pattern of impulsivity and the instability of interpersonal relationships in the patient. Okay, and instability in the person's self-image. Impulsive BPD, occasionally or chronically referred to as impulsive personality disorder. So it is a subtype of BPD that is characterized by acting on impulses and engaging in high-risk behaviors with a difficulty in controlling such urges for the patient. Okay, so let us see the option B, that is liability of mood. Okay, so liability of mood, that is referred to rapid and intense change in a person's emotions or moods. Okay, that is mainly present in the patient with BPD. Okay, and if you are saying the option E, It is self-destructive behaviors. Okay, so it is also called as self-destructive disorder. Okay, so this self-destructive disorder, that is a one type of BPD. Okay, and this liability of mood. Other than that, the option A, impulsiveness. Okay, so impulsiveness and the self-destructive behavior or self-destructive disorder, that is a one type of, these are the two types of BPD. Okay, so this self-destructive behavior disorder, that is indicated by thought and tendencies related to self-harm and self-destructive behaviors. Okay, so here the patient is more harmful towards himself and trying to harm to others also. And let me see the option C, that is this ritualistic behavior. So that is refers to doing things repeatedly, like example, checking the door, that is more times than necessary to ensure it is locked or not. Okay, so that is mainly present with the patient who are schizophrenia and OCD. So that option is not correct. And if we see the option D, that is psychomotor retardation. That is consist of slowing down of thoughts and physical movements, that is often as a symptom of mental health conditions. Okay, and that is due to any side effects of any medications or due to any substance abuse to occur for the patient. It is most often observed in people with major depressive disorder, but can also occur in people with bipolar disorder and schizophrenia. For example, the activity of daily living, okay, patient feel extremely difficult to do. So here this answer also not appropriate with the question. So here the correct answer is option A, B and E. Question number 4. A client with stage 2 pressure ulcer has methicillin resistant Staphylococcus aureus cultured from the wound. Contact precautions are initiated. Which rule must be observed to follow contact precautions? Options. Option A, a clean gown and gloves must be worn when in contact with the client. B, everyone who enters the room must wear a N95 respiratory mask. C, all linen and trash must be marked as contaminated and sent to biohazard waste. And D, place the client in a room with a client with an upper respiratory infection. So here the correct answer is option A, a clean gown and gloves must be worn when in contact with the client. Okay, so a clean gown and gloves must be worn when any contact is anticipated with the client, okay, or with the contaminated items in the rooms. Okay, so let me see other options. Option B, a respiratory mask, okay, that is required only with airborne precautions, not contact precautions. And if you are seeing option C, all linen, okay, that must be double bagged and clearly marked as contaminated. And if you are seeing the option D, the client should be placed in a private room or in a room with a client with an active infection that is caused by same organism and no other infections. Okay, so here the correct answer is option A. Question number 5. A nurse is viewing the cardiac monitor in a client's room and notes that the client has just gone into ventricular tachycardia. The client is awake and alert and has good skin color. The nurse would prepare to do which of the following? Options. Option A, immediately defibrillate. B, prepare for pacemaker insertion. C, administer amiodarone intravenously. And D, administer epinephrine intravenously. So here the correct answer is option C, administer amiodarone intravenously. So as a first line treatment of ventricular tachycardia, the client who is hemodynamically stable, so there is the use of anti-dysrhythmic medicines, okay, that is most important, such as amiodarone, or we can able to use lidocaine or procainamide we can able to use. Okay, so the cardiovation that is also may be needed to correct the rhythm. Okay, so mainly the cardiovation that is recommended for stable ventricular tachycardia patients. Okay, let me see other options. Option A, defibrillation that is used with pulseless ventricular tachycardia. Okay, and if you are seeing the option D, epinephrine that would stimulate more the ventricle. Okay, already the ventricle is excited. Okay, so that is a contraindicated. Epinephrine is contraindicated. So here the correct answer is option C, amiodarone.